Return on investment for VistA at the Veterans Health Administration. Electronic medical record systems, or EMRs, or other IT projects have the potential to provide substantial benefits to healthcare providers and their organizations. However, these organizations should evaluate the return on investment of such IT projects. This is due to the fact that implementing an EMR or other IT project is a considerable undertaking due to the significant cost and resources needed. Therefore, there should be substantial evidence from a return on investment or cost-benefit analysis that the financial benefits from implementing an IT project, such as an EMR, outweighs the costs of implementation and maintenance. The Veterans Health Administration, or VHA, focuses on providing healthcare services that are uniquely related to veterans' health or special needs. The VHA is the largest integrated healthcare provider in the United States, treating nearly 700,000 patients on an inpatient basis and providing more than 40 million outpatient visits at over 800 healthcare facilities throughout the country. The VHA is also the nation's largest provider of healthcare education and training. It provides training to more than 80,000 health-related students and medical residents each year, resulting in more than half of the United States practicing physicians receiving their training at VA hospitals. VistA, or the Veterans Health Information Systems and Technology Architecture, has its roots in the late 1970s. VistA is an integrated health information and management system consisting of more than 100 programs to support the day-to-day clinical, financial, and administrative functions of the Veterans Health Administration. VistA allows VHA providers to view electronic health records, including images, throughout the VA's 1,400 site system. The price of maintaining the VistA system is $87 per patient per year, which is considerably less than the cost of one unnecessarily repeated procedure, showing that an EMR can save money to the overall healthcare system of the United States. The purpose of this presentation is to examine the relationship between three variables involved with VistA at the VHA. The three variables are investment in information technology, use of information technology, and cost of care. To complete this project, we first gathered the data on our three variables, then verified associations between the variables to determine causality about whether IT investment and use has led to an increased cost of care at the VA or whether a reverse relationship is true. The sources of our data are as follows. The cost of care was taken from the VHA fiscal year 2008 budget estimate medical volume. IT investment was taken from the VHA fiscal year 2008 volume 2 budget for departmental administration and is the budgeted amount for the entire IT program at VHA. IT use was taken from September 2005 VHA statistics and was predicted forward based on a daily increase in the size of the database. IT use is measured as the number of files in the database, including orders, images, prescription administration, etc. As here you can see the correlations between our three variables: cost of care, IT investment and IT use. When you calculate the relationship between the three variables as a whole, you can see that cost of care leading to IT investment, which leads to IT use, is closer to zero. Here is a graphical illustration of one of the correlations, in this case the correlation between IT investment and cost of care. As you can see, it is a positive correlation. As stated on a previous slide, our results show that it is IT investment and IT use driven by an increase or decrease in cost of care at the VHA. This means that as costs of care increases, so is there an increase in IT investment and IT use. From this project, we felt that applying correlations to determine cause and effect of IT investment, IT use, and another variable, in this case cost of care, gave a more realistic sense of whether IT projects are worth their cost than a standard return on investment analysis. A standard ROI typically predicts expected savings but does not often show actual savings that will be experienced. We felt that close attention should be paid to the appropriateness of the variables involved. As with any statistical data, the selection of your variables can be chosen to enable a desired outcome. In addition, variables should be selected that deal with a true cause and effect relationship in the organization. This process will show a relationship between any three variables, but that does not mean that they have a true cause and effect in actual use in the organization. Finally, while it is important for any organization to be able to identify whether its IT investment has been useful to their productivity and profitability, we feel that individual healthcare organizations also need to be aware of how their actions may benefit the larger healthcare arena. While individual organizations may not see a great financial or productive benefit from EMRs, their impact could be great to healthcare as a whole by reducing the overall healthcare costs through reduction of unnecessary procedures. Thank you for viewing our presentation.